below. Welcome to Home Health Solutions from our channel.
Mainstream medical treatment. After the diagnosis of diabetes, modern mainstream medical treatment consists of either oral hypoglycemic agents or insulin. Oral hypoglycemic agents. In 1955, oral hypoglycemic drugs were introduced. Currently available oral hypoglycemic agents fall into 5 classifications according to their biophysical mode of action. These classes are biguanides, glucosidase inhibitors, meglitinides, sulphonylureas, and thiazolidinediones. The biguanides lower blood sugar in 3 ways. They inhibit the liver's normal release of its glucose stores, they interfere with intestinal absorption of glucose from ingested carbohydrates, and they are said to increase peripheral uptake of glucose. The glucosidase inhibitors are designed to inhibit the amylase enzymes produced by the pancreas and which are essential to the digestion of carbohydrates. The theory is that if the digestion of carbohydrates is inhibited, the blood sugar level cannot be elevated. Insulin. Today, insulin is prescribed for both the type 1 and type 2 diabetics. Injectable insulin substitutes for the insulin that the body no longer produces. Of course, this treatment, while necessary for preserving the life of type 1 diabetic, is highly questionable when applied to the type 2 diabetic. It is important to note that neither insulin nor any of these oral hypoglycemic agents exert any curative action whatsoever on any type of diabetes. None of these medical strategies is designed to normalize the cellular uptake of glucose by the cells that need it to power their activity. The prognosis with these modern mainstream treatments is increasing disability and early death from heart or kidney failure or the failure of some other vital organ. Alternative medical treatment. The only way to reverse this disease is to become informed and to apply an alternative methodology that is soundly based upon good science. Effective alternative treatment that directly leads to a cure is available today for some type 1 and for many type 2 diabetics. For the type 1 diabetic, an alternative methodology for the treatment of type 1 diabetes is now available. It was developed in modern hospitals in Madras, India, and subjected to rigorous double-blind studies to prove its efficacy. It operates to restore normal pancreatic beta cell function so that the pancreas can again produce insulin as it should. This approach apparently was capable of curing type 1 diabetes in over 60% of the patients on whom it was tested. The major complication lies in whether the antigens that originally led to the autoimmune destruction of these beta cells have disappeared from or remain in the body. If they remain, a cure is less likely; if they have disappeared, the cure is more likely. For reasons already discussed, this methodology is not likely to appear in the United States anytime soon, and certainly not in the American mainstream medical community. The goal of any effective alternative program is to repair and restore the body's own blood sugar control mechanism. It is the malfunctioning of this mechanism that, over time, directly causes all of the many debilitating symptoms that make regular treatment so financially rewarding for the diabetes industry. For type 2 diabetes, the steps in the program are: repair the faulty blood sugar control system. This is done simply by substituting the pristine-looking but toxic trans-isomer mix of fats and oils found in attractive plastic containers on your supermarket shelves with clean, healthy, beneficial fats and oils. Consume only flax oil, hemp oil, coconut oil, fish oil and occasionally cod.
Dr. Julian Whitaker. Hundreds of clinical trials demonstrate that diabetes can be reversed, not with drugs but with simple, inexpensive lifestyle measures. 7 Steps to Health and a Big Diabetes Lie. Full of scientific studies, nutrition tips, insider information and the exact steps to take so you can stop treating your diabetes, and finally start beating it. If you are tired of popping pills, living with the risk of toe amputations, blindness, greatly increased risk of developing cancer, heart disease, stroke, high cholesterol, and would like to discover in detail the exact steps tens of thousands of people all around the world have taken to destroy their diabetes. This free recipe book includes snacks, appetizers, entrees, desserts, shakes and more. I share this book hoping it will help people subscribe and receive it in your email. Subscribe. Please register to receive new posts from our Health Solutions channel. Thank you.